provided privacy, performed hand hygiene. Hello, my name is Danielle. I'm going to be your student nurse today. Can I get you to verify your name and your date of birth, please?
Angel DeSillis, true 194.
Okay, thank you. So today we're going to be performing a postpartum assessment, and it should take about 5 to 10 minutes, okay?
Okay.
All right, so first thing I'm going to do is just start off with some birth history. This is your first newborn, is that correct?
Yes.
All right, and then are you breastfeeding?
Yes.
Okay, and did you have this baby vaginally?
Yes.
Okay, and no complications?
No.
No? Okay, good. So then we're gonna go ahead and do vital signs, which everything was within the normal limits. All right, so now we're gonna go ahead and assess your breasts, okay?
Okay.
So since you are breastfeeding, I will palpate, is that okay?
Mm-hmm.
All right, so when I palpate it, they should be soft, non-tender. We're gonna go ahead and look at the nipples and the areola. With newly breastfeeding moms, it is normal if there's a little bit of cracking and ulcers and blisters, which I see there are a little bit, but this is, you said this is your first baby, so that is normal. With a non-breastfeeding mother, we would suggest that they would not shower and get water on their breast because that does promote lactation, and we would ask them to wear sports bras as well. Okay, and so next up we're gonna go ahead and go to the uterus, okay? So I'm just gonna put one hand here on your pelvic bone and one here over your umbilicus, and I'm just gonna palpate, and I should feel the uterus midline, and it should be firm and not boggy. If it was boggy, then I would wait until the uterus firms to remove my hand. Okay, and then sometimes the bladder can move the uterus kind of off-centered, and if that was the case, then I would ask her to urinate, and then we would go ahead and try to reassess. Moving to the bladder, have you had any, have you urinated at all recently?
Yes.
You have? Okay. And was it a frequent amount, like normal?
Mm-hmm.
Okay.
Normal.
And then did it hurt at all?
No.
No? Okay. What about your bowel movements? Have you had one recently?
Yes.
Okay. And that was about normal amount?
Mm-hmm.
Okay. No pain?
No.
Okay. And sometimes women, they won't have a bowel movement, and that's normal for a couple days. The body has to readjust. So I would just tell them that that's normal, and you know, don't hold it in because that can make constipation worse, and just drink some water. That'll help as well. All right, so next up, we're gonna go ahead and assess your lochia. So with that, we're looking for lochia rubra, which is gonna be a red color. And with this patient, she does have a moderate amount, so that's okay. We would just keep on assessing. And at home, you're gonna notice that it does change color. It'll go from red to pink to like a yellowish white, and that is normal. But if you feel like it's abnormal, just let us know, and then we can go ahead and assess that again, okay?
Okay.
All right, and so now we're gonna go ahead and look at the perineum and the episiotomy. So this patient did not have an episiotomy, but we're still gonna go ahead and assess the perineum, and we're gonna make sure that we're gonna assess Rita. So see if there's any redness, edema, ecchymosis, drainage, or accommodation. So there is a little bit of edema and redness, and that's normal within having birth. There's no ecchymosis, no bruising or anything. There's a little bit of drainage, which is normal, and everything is approximated as she did not have an episiotomy. And so next we're gonna go ahead and assess Homan sign. And with that, I'm just gonna palpate your legs, okay? You let me know if anything hurts at all. Does that hurt?
No.
No? Okay, and I'm just gonna flex your feet. How about that?
No.
No? Okay, good. So we don't have any blood clots or anything. The next thing we're gonna do is just assess the emotional status with the mother and the baby. Have you had any history of depression in your family?
No.
No? Okay. And she does not appear to look depressed at all. But we'll just keep on assessing just to make sure that postpartum depression isn't present. And then with this mother, it does seem like she's taking care of her baby, she's feeding it, she's tending to its needs. And then lastly, we would assess for ROGAM. And with that, we'd have to make sure that the mother and the baby are the same, and we could assess lab values, and if not, then we would have to administer it within 72 hours. All right, Ms. DeSillis, well, thank you so much, and you have a great day, okay?